Bogotá will not have to impose strict quarantine measures after the Colombian capital received respirators to treat severe cases of COVID-19.
In July, the city will be protected without the risk of going on red alert. If in August we see that the demand for respirators is greater than 722 ventilators, then the Health Ministry and FOAM, Emergency Mitigation Fund, would make an additional delivery.
The city's health officials issue a red alert when hospital intensive care units exceed 75% occupancy. Before receiving 200 new units on June 30th, Bogotá's ICUs were at the brink, 73.4% occupancy, fueling fears that the city was unprepared for a surge in coronavirus cases. Bogotá's mayor has criticized the Colombian president's decision to gradually reopen the economy. The majority of citizens have been under lockdown since late March. The quarantine has been extended until July 15th, but with some restrictions loosened up.
We need to understand that for the sustainability of our society, it is not a viable option to stay closed off until there is a vaccine.
As the number of coronavirus cases continue to climb, the biggest concern is that Colombian hospitals have sufficient beds and ventilators to tend to patients. 4 months ago, Colombia had only half of the recommended 10,000 intensive care units. A government audit shows there are now around 7,000 ICU beds available, and President Duque says 4,000 ventilators are expected within the coming months.
All of this is so we can start off as a secure country, so life can win over the coronavirus, and so that we may understand that just as important as it is to protect our lives and health, it is important to protect employment and businesses.
Due to the lockdown measures, the unemployment rate hit 21.4% in May. So like the rest of the world, Colombia is engaged in a balancing act, maintaining lockdowns to curb the pandemic and now cautiously lifting them in phases to keep the economy going. Michelle Vega, CGTN, Bogotá, Colombia.